and here we have another video about pharmacology because learning pharmacology is fun.
Today we are going to talk about anticholinergic agents used as anti-Parkinsonism agents. For my drug name, my generic names are benztropine and trihexyphenidyl hydrochloride. For my brand names, cogentine and artane. Now this is my chemical name.
Now let's talk about my drug classifications. My therapeutic classification is anti-Parkinsonism agents. Meanwhile, my pharmacologic classification is anticholinergic drugs.
My pregnancy category for benztropine, the US FDA pregnancy category is not formally assigned, but for AUTGA pregnancy category, it is category B2. Now for trihexyphenidyl hydrochloride, the US FDA pregnancy category is category C. Now for the AUTGA pregnancy category, it is category B1.
Now let's talk about my mechanism of action in benztropine. I antagonize acetylcholine and histamine receptors in the CNS and smooth muscle. I exert my action through competing with acetylcholine at muscarinic receptors. Consequently, it reduces central cholinergic effects by blocking muscarinic receptors that appear to improve the symptoms of Parkinson's disease. Thus, benztropine blocks the cholinergic muscarinic receptor in the central nervous system. Therefore, it reduces the cholinergic effect significantly during Parkinson's disease, which becomes more pronounced in the nigrostriatal tract because of reduced dopamine concentrations. Now, let's talk about my mechanism of action in trihexyphenidyl HCl. I belong to a class of medication called anticholinergics that work by blocking a certain natural substance, acetylcholine. This helps decrease muscle stiffness, sweating, and the production of saliva and helps improve walking ability in people with Parkinson's disease.
My pharmacokinetics. For benztropine, benztropine is administered orally and parenterally. It crosses the BBB or blood-brain barrier and it may cross the placenta. Benztropine's metabolism is unknown, but most of the drug is excreted renally. However, after oral administration, a small amount of the drug is excreted unchanged in the feces. For trihexyphenidyl hydrochloride, its absorption, rapid, distribution, crosses the BBB or blood-brain barrier, metabolization is unknown and excreted through urine. Its half-life is 6 to 10 hours. For my indications, I am used to treat the symptoms of Parkinson's disease and I am used to treat involuntary movement due to an effect of a certain drug.
Now let's talk about my contraindications in benztropine. I am contraindicated in closed-angle glaucoma. I, like other anticholinergic medications, should be avoided in patients with closed-angle glaucoma because I can induce cycloplegia and mydriasis resulting in increased intraocular pressure. So contraindicated for patients who have hypersensitivity on benztropine mesylate. Also contraindicated for bladder obstruction, prostatic hypertrophy, and urinary retention because I can exhibit anticholinergic effects and should be used cautiously in patients with benign prostatic hypertrophy or bladder obstruction because it can exacerbate urinary retention. Dysuria may occur but rarely becomes a problem. Urinary retention has been reported. I am also a big no-no for cardiac disease and tachycardia. As with other drugs with anticholinergic activity, you should only use me with caution in patients with cardiac disease and pre-existing tachycardia because it causes tachycardia secondary to cholinergic antagonism at the sinoatrial node. Also contraindicated in behavioral changes, dementia, driving or operating machinery, and psychosis. I may impair mental and physical abilities and cause blurred vision due to the anticholinergic effects, thus impairing the performance of hazardous tasks such as driving or operating machinery. I am also contraindicated in autonomic neuropathy and myasthenia gravis. I should be generally avoided in patients with myasthenia gravis because the anticholinergic effects of the drug compete with acetylcholine and may exacerbate muscle weakness. Also in alcoholism, ambient temperature increase, and hyperthermia. Since I contain structural features of atropine and thus significant anticholinergic effect, may produce anhidrosis. I am also a big no-no in pregnancy and breastfeeding. According to the manufacturer, the safe use of benstraline during pregnancy has not been established. Meanwhile, in breastfeeding, it is unknown whether I can be excreted in human milk, and there are no breastfeeding recommendations available from the medical literature. Now let's talk about my contraindications in trihexyphenidyl HCl. I am contraindicated in those who have hypersensitivity to me or to any of my drug formulation ingredients. I am also contraindicated in narrow angle glaucoma because I have an anticholinergic activity that will cause mydriasis, further narrowing the angle of the lens, increasing the IOP, and worsening the condition. Let's talk about my side and adverse effects. Let's start with benstropine. My adverse effects in the CNS is fever, confusion, depression, delusions or hallucinations, and vision changes. Meanwhile, in the cardiovascular system, fast, irregular or pounding heartbeat, and in the gastrointestinal system, constipation, vomiting, nausea, and loss of appetite. Meanwhile, in the genitourinary system, difficulty or pain when urinating. My other adverse effects are dry mouth and rash. Let's talk about my side effects or adverse effects in trihexyphenidyl HCl. In the central nervous system, I can cause dizziness, nervousness, drowsiness, forgetfulness,
restlessness,
and trouble with sleeping. In the gastrointestinal system, I can cause nausea and constipation. Meanwhile, in the genitourinary system, I can also cause trouble in urinating. My other adverse effects are dry mouth, blurred vision, muscle spasm, and involuntary body movements.
The nurse's responsibilities before administering me is first to obtain health history, a complete health history, including allergies, drug history, and possible drug interactions. Second, to obtain baseline of severity of the Parkinson's symptoms to determine its effectiveness. Third is to assess of use of other medications. Fourth, to obtain laboratory work to include a complete blood count or a CBC, liver and renal function studies. And lastly, to obtain a baseline vital signs, especially the pulse.
Now let's talk about the nurse's responsibility during benstropine administration. I should be begun with low dose then gradually increased. Monitor proper storage of benstropine. Monitor environmental temperature. Patient will have decreased ability to tolerate heat and may develop heat stroke. Monitor patient's ability to void as well as intake and output, or I can cause urinary hesitation or retention secondary to my anticholinergic effect. The nurse should also observe for increased symptoms of Parkinson's or EPS, such as if involuntary movements or increased rigidity occur, medication levels may not be therapeutic. Observe also for unsafe activity because eye may cause sedation or dizziness. Let's talk about the nurse's responsibility during trihexyphenidyl HCl. We should decrease my dose as ordered if therapy has been interrupted to prevent systemic dopaminergic effects. You should also give me with meals to alleviate GI irritation if present. Have patient void before taking the drug to decrease the risk of urinary retention. Provide comfort measures to help patient tolerate the drug effects. Provide safety measures such as adequate lighting, raised side rails, etc. to prevent injuries.
The nurse's responsibilities after administering benztropine is first, to assess therapeutic effectiveness. Clinical improvements may not be evident for 2 to 3 days after the oral drug administered. Second, monitor input and output ratio and patterns. Advise patient to report difficulty in urination or infrequent voiding. Third, closely monitor for appearance of signs and symptoms of onset paralytic ileus, including intermittent constipation, abdominal pain, diminution of bowel sounds on auscultation and distension, and also to monitor and report muscle weakness. Next is to supervise ambulation, and lastly to report immediately signs and symptoms of CNS depression or stimulation. For trihexyphenidyl hydrochloride, be aware that incidence and severity of adverse effects are usually dose-related and may be minimized by dosage reduction. Second is to monitor vital signs, especially the pulse. Third, assess and report severe CNS stimulation that occurs with high doses and in patient with arteriosclerosis. Fourth, in patient with severe rigidity, tremors may appear to be accentuated during therapy as rigidity diminishes. Fifth, monitor daily input and output. Sixth, check for abdominal distension. Seventh, monitor intraocular pressure or IOP. And lastly, provide close follow-up care.